Today we will speak about different types of diabetes, so let's start. There are five types: type 1 diabetes, type 2 diabetes, LADA, moody, and gestational diabetes. Type 1 diabetes mellitus, mostly in children and adolescents. There is no or very little insulin due to autoimmune destruction of pancreatic beta cells. This means you need daily insulin. It's insulin dependent diabetes mellitus. There is positive antibody, anti-insulin, anti-islet, and GAD antibody. Type 2 diabetes, the most prevalent type, 90%, mostly in adult, characterized by variable degree of insulin deficiency and insulin resistance. Main treatment is lifestyle modification and oral medication. Moody or maturity onset diabetes in young, it's non-insulin dependent diabetes mellitus in a young patient less than 25 years old. It's autosomal dominant but no autoantibody detected. How to diagnose? By genetic testing. You will find mutation in hepatocyte nuclear factor 4A and 1A. When to suspect? When you find familial diabetes in more than two generations, onset of patient less than 25 and negative autoantibody. LADA or latent autoimmune diabetes in adult. It's a type 1 diabetes in a patient more than 25 years old, positive autoantibody, don't need insulin at diagnosis but progress to insulin dependence after several months. It's very rare. Home message: classification of diabetes into type 1 or 2 depend on presence or absence of autoantibody. Type 1 positive autoantibody, type 2 negative autoantibody. But when to measure autoantibody? If the diagnosis of diabetes is not certain type 1 or type 2, or poor response to metformin or sulfonylurea, or there is personal or family history of autoimmune disease.